All right, blood flow restriction therapy is revolutionizing the physical therapy industry, but what exactly is it? We have doctors of physical therapy, NICOLE STOKER, EVANS, and Gina Tolomero, along with patient Threebestrated, here to tell us about this technique. Now, Nicole, tell us, what is blood flow restriction? It's hard to say.
It is hard to say.
What a mouthful.
It's a tongue twister.
And it's rehabilitation as well?
Yeah, so blood flow restriction rehabilitation is a technique that we use in our clinics to help improve strength and decrease muscle atrophy. The cool thing about it is it's allowing the patient to get those gains with very little weight.
Okay.
So you can see Bree is lifting a 5-pound weight on her leg. That's much less than she would normally need to lift to get the strength gains that we want.
Okay.
This device is actually occluding the pressure and blood flow to her leg by about 80%, which seems like a lot.
Yeah.
You'll notice her leg will start to change color a little bit.
Oh boy.
And
it's safe?
It is safe. In the upper extremity, we occlude to 50%. What that does is causes an increase in lactate.
Okay.
And that's that burn that you feel when you're working out that nobody likes, but it causes effects. It's going to increase growth hormone to that extremity, and that allows us to get those strength gains that we would normally get when we were lifting very heavier weights.
Interesting. So could this be a way for people who haven't quite gotten up to the weight that they want to, or does this still feel heavier? Does that feel heavier than 5 pounds?
Oh yeah, way heavier than 5 pounds.
Oh, that's crazy. Okay, so Gina, who would be a good candidate for this?
Our post-op patients are really good candidates because typically after any type of a reconstructive surgery, whether it's in their shoulder, their rotator cuff, or an ACL reconstruction, meniscus repair in the knee, they have range of motion restrictions, so we can't take them through their full range. So it's really hard to strengthen muscles when you can't get them to their full range. So the benefit of the BFR is it basically creates an environment where we can challenge those muscles at 75 to 85% of their 1 rep max without jeopardizing the integrity of the surgical graft.
Oh, wow. Okay, can you describe, Bree, what it feels like doing this?
It feels like I'm lifting a really heavy weight.
Really? Really?
Oh, yeah.
How heavy, if you could compare?
Probably like 50 as opposed to 5. Oh yeah.
Oh my gosh. Now, how does that really work, though? Is it? It's really
so it's almost tricking the brain into releasing that growth hormone. So again, because it's occluding and decreasing blood flow to the leg, it's allowing the brain to get to that point where it feels like it's under a lot of stress, even though it's not, and then releases that growth hormone so that we can get the gains. So Bree had a really hard time initially with her recovery. You want to talk about that a little bit?
My recovery started to plateau a couple months after surgery, and I'm a really active person, so I was super heartbroken when I found out I had to have surgery.
And what was your surgery?
I tore my ACL and my meniscus.
Ouch.
Yeah.
And so did you kind of hit a wall with regular physical therapy?
I did. I began to plateau and I got really frustrated and I just stopped seeing any improvements. And after just 2 sessions of BFR, I really started making some like massive strength gains for sure.
And is that pretty common, 2 sessions?
It's pretty common. Typically within the first 1 to 2 sessions, you're going to see a reduction in pain, which is everybody's favorite part of it.
Yeah.
And then strength gains very quickly.
That is really cool. So 2
cool.
sessions, how else has this, would you say, assisted your recovery? Are you ready to go?
I'm almost there. I need a few more sessions, but I've had so much decreasing in pain. I've been able to get back to a lot of the activities I missed before surgery. So,
wow.
Yeah, it's fabulous.
That is awesome. Good for you. I mean, do you think something like this would ever be just like how we work out instead of just used for physical therapy?
It can be, and some people use it for that. The challenge to that is that we still want to stress those tissues. So for our athletes that are trying to get back to sport, you do need those external stresses on the body. So this is kind of a bridge.
Okay.
We wouldn't want someone to continue with this. It is an easier way to get strong, but it's definitely not the best way for long-term results.
Sure.
So as soon as Bree is strong enough to load the joint, we load the joint.
Okay, very cool. All right, and we've got your information up here right now where all you can go to find out more information. That's synergyptnv.com. There are 3 locations. You can also call 702-489-9217. Thanks for joining us, ladies.
Thanks for having us.
Appreciate it.